Welcome to another fantastic episode of the Mtoto News Inside, this week brought to you by Omar Hamid. But before we get to the news stories, let's get our headlines today. At least 2 out of 5 adolescents do not know that they can be infected with COVID-19 and exhibit no symptoms, or that they can be asymptomatic and pass the virus on to others. Parents of disabled children concerned over face mask. Toddlers and children up to the age of 2 experience breathing problems when wearing a mask. On our explainer today, we learn how to make a mask. On to our first news story: adolescents' response to COVID-19. According to PHON's survey conducted by Population Council 2020 to gauge adolescents' understanding of COVID-19 and its impact in the informal settlements of Nairobi, mostly in Kibera, Huruma, Kariobangi, Dandora and Mathare, which started from June 13th to 16th, 2020. At least 2 out of 5 adolescents do not know that they can be infected with COVID-19 and exhibit no symptoms, or that they can be asymptomatic and pass the virus on to others, as 83% of adolescents have left their house in the past weeks. 89% of the adolescents who had been attending school before the COVID-19 closures think they will return when it reopens. However, 59% report that the difficulty in paying school fees could prevent them from returning. Girls are slightly less confident than boys that they will definitely return to school. Nearly all 97% report currently doing schoolwork or learning from home. Yet, a fifth, 20%, have been provided the lessons from their schools, and 2 in 5, 40%, cannot access the lessons provided. There is a clear gender-digital divide in terms of access. 78% are eating less or skipping meals more often than before the COVID-19 pandemic began. 74% of adolescents are no longer receiving the daily free food from schools. Half of the adolescents reported depressive symptoms thinking about COVID-19. 81% feel threatened, concerned, scared, or anxious. 95% reported wearing a face mask the last time they left their home, and the vast majority, 93%, reported washing their hands upon returning home. Over half of girls, 51%, have been having troubles accessing their preferred menstrual hygiene management products since the COVID-19 pandemic began. From the data, these particular adolescents seem to understand about the pandemic. However, boys are likely working and looking for income, as girls are forced to do house chores regardless of time spent of their homes. Clearly, there is a need for provision of good health care and services, food, essential like pads to adolescents to ease the economic pinch, which can lead to despair and desperate moments during the pandemic. Parents of disabled children concerned over face mask. A mom who runs an autism support group is appealing for more understanding for young people who cannot wear face masks. Daniel Smith from the UK says parents have been publicly criticized because their disabled children did not have the coverings. This is from an interview conducted by BBC News. She appeals to people to treat their children with much ease and with much understanding of their condition, as it takes time for these parents to build their children up to tolerate the outside world, and one negative experience can leave them traumatized for months afterwards. According to the UK government, children under 11 and children with disabilities have been exempted from wearing a mask. On to a third news story. Toddlers and children up to the age of 2 experience breathing difficulties when wearing a mask. Reports states that children are likely to spread and contract the virus. They are asymptomatic carriers or pre-symptomatic carriers. There have been doubts of if children should put on masks or not, hence leaving parents or caregivers in doubts of whether they should or not. It is advisable to carefully note that toddlers and children up to the age of 2 years have small airways, and putting a mask on them risks their lives and could result in breathing difficulties leading to suffocation. It is only reasonable to state that parents and caregivers with children below the age of 2 years should take necessary measures, like putting a covering over the baby, carriers, or a protective clothes over them on public places, or ensure social distancing at all times, or rather avoid public places if possible. Wearing a mask should be keenly noted, as it protects me to protect you, which protects both of us from the risk of getting the virus. Before we head to our news explainer this week, it is important to know that until we have vaccines or medicines to fight COVID-19, wearing a mask together with hand washing and social distancing is one of the best tools we have to protect ourselves and those around us. The Pandemic Action Network is holding the first ever World Mask Week. This week, do you know you can make a mask at home by yourself? Here's Karen demonstrating how to make a simple mask using a sock.
Hello everybody, welcome to this week's explainer with me, Karen. So, today we're gonna learn how to make a mask like this from a sock like this. But first, you'll need adult supervision and you really need to be careful with using scissors. And also you need to be allowed to cut up your socks. So first, you'll take the sock and you see where your ankle goes. You need to fold your sock like this. So you'll get like something like this. So then, you'll cut along that line. But remember to be very careful while using scissors. Next, you'll take this part, the one that has two ends and you can stick your hand through. See? This one, we'll put it away for the next. Just put it away. Next, you're gonna take your scissors and cut along this line. Along the top like this, see? Like that. Until the end. Now you got something like this. Next, you'll have something like this. Now we're gonna fold it in half like this. So we'll get two equal sides. Now, you have to look carefully. We're gonna fold the sock like this. And then, like this. And then we're gonna cut a small slit like this. But don't go all the way because that's where your ears will go. See? Now I'm gonna open it up and ta-da! You got your own mask.
It's really amazing on how Karen could make a mask using a sock. I hope you also tried it at home. I know I will. But that's all we had for you today. But for more information, you can catch us at our social media platforms at Mtoto News or visit our new website at www.mtotonews.com. I am Omar Ahmed.